So good afternoon, everyone. I'm Garbett, and I'm really quite excited to be here today to share something that's a little bit different around fire safety. So my role as the fire safety specialist is to provide expert support and guidance to the trust in all aspects of fire safety. I work with the clinical and non-clinical teams to try and prevent what you can see in those photos there. These are of some of the UK hospitals that had quite severe fires, and my role is to try and prevent that by working with everyone across the trust. Unfortunately, fires in hospitals and medical care facilities in England are not unheard of. In the financial year for 2021-22, there were 529 fires in hospitals and medical care facilities in England. These ranged from quite small fires that didn't cause too much damage to much larger fires that wiped out services for days, weeks, and months at a time. Now, although you can see a downward trend in the number of fires over the years, there have still been 8,200 fires since 2010, and they have caused over 500 unnecessary injuries and 6 fatalities in hospitals and medical care facilities in England. In our own hospital since January 2022, we've also seen some fires. This is a picture from our maternity courtyard entrance. We had a bin fire in a toilet in the hospital street next to renal. We've had a toaster fire in our neonatal unit. This year we've had a lead acid battery fire in main theatres, and we also saw a microwave fire in Ward C8. Now, all of these fires were very small, thankfully, and they were dealt with very quickly, but they could have been much worse, especially that one in neonatal where we wouldn't want to move those poorly babies, and that one in main theatres where we had a patient on the operating table at the time of the fire. In the same time period, we've also had 80 false fire alarms. And for me, this was 80 opportunities for us to practice our response to a fire alarm and get it right. So that in the event that we do have a real fire on site, our response will be calm and intuitive, and there won't be any injuries or deaths as a result of a fire here on our site. Now, across the site, we have got a 3-stage fire alarm system. It allows us to follow a phased, progressive, horizontal evacuation process. And that's just a really fancy way of saying it means that we can move side to side in the first instance to make sure that we can continue care for our patients inside the hospital. This is a really simplified visual representation of that 3-stage fire alarm system, telling you the types of fire alarm that you might hear depending on your location to the fire. My project was focused on what you would have to do on hearing the 45-second intermittent alarm. If you do hear that, there are 2 actions that you might have to take. The first is if you find that the fire is on the same floor as you, then all available staff from your department need to go to that department and offer help. If, though, you find that the fire is on a different floor to you or it's in a different building, a minimum of 1 staff member from every single department needs to be sent to our staff assembly point to become part of the backup team. And this is the specific focus of my project. Now, you may be asking, why is this so important? Why have I spent so much time trying to make sure that we get in compliance to this part of our fire safety policy? And it's because the backup team that arrives to the staff assembly point becomes your support in the event that we have a fire. What I need you to think about is, what would you want to happen for your patients that are highly dependent on you and can't walk out on their own? These are the bits of kit that the backup team at the staff assembly point would be collecting for you to help save the lives of our highly dependent patients. They're called evacuation mats. They're quite big, they're quite bulky and heavy. One person might be able to collect 2 pieces of equipment. Now, if As per process, we get one person from every department. We should see about 35 to 40 people attending to the staff assembly point, and that should be enough to collect between 60 and 80 pieces of kit to help evacuate your patients safely. Now, at the very start of the project, I started by looking at some of the data that I'd already collected in regards to staff assembly point attendance. And I've chosen to focus on correct attendances to the staff assembly point. So that's people attending who are from a different floor or a different building to where the fire is. I've used the statistical process control tool to display that data for you. Along the x-axis, you can see the dates of all of our fire alarms that occurred throughout 2022. And on the y-axis, we've got the numerical value. Every single dot on that graph shows you the number of people that attended to the staff assembly point on hearing that 45-second intermittent alarm. Now, the first thing I'd like to point out is you can see there that there were several alarms last year that had absolutely no one attend to the staff assembly point. That would mean that there would be no backup team, and it would cause serious delays in getting help to where it's needed in the event of a real fire. This is the starting point of my project, and just after that you can see a series of blue dots. That represents a sustained improvement compared to the rest of the year. I then looked at the average number of people attending to the staff assembly point so I could measure the impact of the project. And across our 56 fire alarms last year, the average was just 3.55 people per alarm. I then got to work on what I wanted to achieve through my project and on my challenge statement. And what I wanted to do was, by the end of March 2023 this year, I wanted to target the matron and lead nurse group to try and increase the number of staff correctly attending to the staff assembly point on hearing that 45-second intermittent alarm by just 25%. And this is to make sure that we've got enough staff to obtain that evacuation equipment and save highly dependent patients' lives in the event of a fire on our site. Now, I thought there would be some obstacles to that challenge. The first is that I thought there was a general unawareness of the process. People weren't fully aware of what they needed to do on hearing those different types of alarms. From audits, I found there was a level of complacency. People genuinely thought that somebody else would go and deal with that situation. There's obviously workload pressures. Everybody is incredibly busy across the trust. And then we've got other pressures like the winter pressures and COVID pressures. And the last issue that I wanted to mention was that staff just aren't under my control. It's not something that I can say must be done. I chose during this project to focus on awareness of the process, as I thought that this could be the easiest and quickest way to increase compliance to the policy. So what did I plan to do? The first thing I started with was a really short survey. I used Microsoft Forms and I sent that out to the matron and lead nurse group. Now, I did receive a very limited number of responses back, but it did confirm my suspicions about what the obstacles to the process were. 83% of respondents were able to say that they were aware of what the staff assembly point process was, but only 17% could correctly identify the steps to take. I then started to work on a new standard operating procedure called Investigating Fire Alarm Incidents. And along with a new form that created a report that I could send out to the people involved in the fire alarm, it gave me a much more personal and positive contact with our leads. I could thank people for the correct attendances to the staff assembly point, and it also meant I could work with them to understand what the barriers were that meant that they hadn't sent anybody. I then created a fire safety manual, and you can just see a video of it there of me skimming through it. In there is everything fire safety related. We've got there a detailed 3-stage fire alarm system and all of the steps that leads need to take. And there's also things in there like flammable substance cost assessments, local induction leaflets to give basic safety, fire safety information. And there's also reactive information in there, such as the fire risk assessment and the fire safety audits. Now, once I'd done all those things, I did expect to see an improvement in the number of people that were attending to the staff assembly point, but I did think it would be quite minor because all of the other obstacles and issues still remained. I've now had a look at the data for this year, so for 2023 up until about mid-April, and I'm really pleased to be able to say that we have seen an increase in the number of correct attendances of people down to our staff assembly point by 44.51%. The other thing that I'm really pleased about is that we haven't had a single fire alarm when nobody turned up to that staff assembly point. So it means we've always got someone there who can be called on to go and sort out further help. Now, although I've increased the number of people attending slightly, it's still not where we need it to be. So I have decided to continue with my project throughout 2023. And there's a couple more steps that I'd like to take. The first is to work with the matron and lead nurse group. I understand that they have meetings and I'm trying to get an invite to one of those so I can do a very quick update on that 3-stage alarm system and the steps that they need to take. And I'm also working on a gap analysis of the mandatory training. I provide face-to-face training that about 20% of staff go through each year. And that's really detailed and goes through the 3-stage fire alarm system step by step. The other 80% of staff complete the online e-learning for health module, but that doesn't cover Russell Hall Hospital's 3-stage fire alarm system. The furthest it goes is covering a 2-stage alarm system, and that's because the aim of that module is national. And I think this is the root cause of some of the issues we're seeing, where people are genuinely unaware of the process. I'd just like to finish by saying thank you for listening. She's not on the line, but I do want to say thank you to Emily Johnson, who's our Corporate Resilience Coordinator. She has provided me with a lot of support throughout this project in terms of collecting data and completing audits for me. And I'd just like to say, are there any questions, please?